The Carista Outcomes module was designed after several years of working with our existing Carista customers. It was designed to help them to meet a number of the different challenges that they were facing. Some of these challenges were around the different kinds of outcomes, why these were being measured and how they were being measured. For instance, for a local authority or other commissioning organisation, it is important to collect information on outcomes that can be measured across a whole cohort of people, across hundreds or maybe thousands. This enables the commissioner to target the care, to measure and compare the effects of the care, and to try to ensure best value for money is obtained. And so the commissioner may ask the provider to report on the outcomes using a standard outcomes framework. And measures are usually based on a scale of some kind. As different commissioners target different measures, and as priorities change, so too the outcomes frameworks can change. And so a provider organisation needs to be able to record outcomes against a number of different frameworks. This can be a challenge. Another complication arises when it comes to planning the support for the individual. Often the framework-based outcomes mean very little to them. The language used can often be more suited to care professionals, and the outcomes themselves do not necessarily relate to what the person themselves wants to achieve. And when it comes to reviewing progress, the measurement is more likely to be a discussion and will revolve around feelings and satisfaction levels. How do you feel things are going? Are you happy with the way things are working out? It's also at this stage that some of the distinctions between achieving outputs and outcomes are needing to be identified and recorded. And another significant challenge that we identified through working with our customers was that over the years that sometimes there seemed to be a bit of a disconnect, that they would set the outcomes that were planned, and then what actually happened on a day-to-day support was something quite different. So the outcomes would be discussed and agreed, both with the commissioner and sometimes even with the person themselves, and then day-to-day life would take over. Care would be provided on a regular basis, and the daily notes would be taken. Often these would be a chatty description of what had occurred through the day or during the time that the support was provided. And then, almost as a completely separate process, once a quarter, when the outcomes would be brought out, reviewed, and an assessment of progress would be made, often without much of a direct link to the support notes. Likewise, during that support time, things may happen. Perhaps accidents or incidents, and these would be recorded and managed in the system. But again, they would not necessarily link back in any way to whether or not they had impacted on whether an outcome had been achieved or not. A few direct quotes from customers helped us to clarify some of the challenges we were seeing our customers face. For instance, one was, I read through over 500 case notes yesterday and I was thinking, some of these are important and some are not. Another one was, our staff are already overstretched. We really don't want to ask them to record any more. And also, we want to record less, but record better. And so, taking into account what we were seeing within our customers, with the various opportunities and challenges that they had, we took the decision to help and develop the Carista Outcomes module. So what does it do? Within the Outcomes module are areas for both recording and management of personal outcomes and also for the recording and management of framework assessments. As we have already shown in the Carista Budget Planner video, at the time that a new plan is created, there is the opportunity to add personal outcomes, and these now become available here in the Outcomes module. Within the Outcomes module, we can choose to start with either the personal outcomes or the framework assessments. As we already have some personal outcomes, we can perhaps start this time by considering the framework outcomes. Often, a particular service will have an outcome framework associated with it. In this instance, we will illustrate the use of a popular model for childcare called Shinari. But as we will see later, this can be changed or added to at a later date. Typically, a framework will have a number of categories associated with it. And then beneath these categories, there may be additional subcategories of measurement. At the point of referral, or now at the point of initial assessment, we may well review the framework and identify the areas that are of interest. And as we select these, we have the opportunity to select a score measure. We also have the opportunity to mark some measures as worthy of particular focus. Having completed this initial assessment, we can take a snapshot of the measures and scores and record this either as a baseline, ad hoc, or review assessment. In this instance, we will record a starting baseline. Now, as we come across to look at the personal outcomes, we can also see the areas of focus from the framework, and the priority areas are clear to see. We can now consider the personal outcomes and see how these link to the framework outcomes. As we link these, then gradually what we recognise is that as we work together to achieve the personal outcomes, the things that matter to the individual, we will also be progressing the areas of concern for the provider and funder. It may well be that not all areas of focus will be covered by the initial choices of personal outcomes. And while it is not essential to always have a link, we might decide it would be a good opportunity to discuss and add a new outcome and link it to the framework outcomes. With this all done, we can set about the business of daily life and the provision of support. Regular notes about support can be added into Carista, either directly or via the Carista mobile application. Perhaps even adding a picture or two to tell the story. And as these notes are added, there is the option to tag them with the personal outcomes that have been decided. Other things may happen, perhaps incidents or accidents. We'll not go into a full description of the Carista Health and Safety module in this video, but rather we'll simply add a quick note by way of illustration. And this regular provision of care continues until it's time to review how we're doing as we progress towards the outcomes. Firstly, we may choose to discuss progress towards the personal outcomes. The questions here may be about the degree of progress attained towards the output, and also how the person themselves feels about the progress, which can be a key indication of the outcomes versus outputs. There's also opportunity to add notes at this point. Having completed a review of the personal outcomes, at this point or at a later date, we can also start to review the framework outcomes. As we open a particular measurement area, immediately we see the current and baseline scores that were given, and also the notes that were tagged as being relevant to that outcome. The linked personal outcomes are also visible. So now, as I consider what the new score should be, I have to hand information and evidence to help me make my decision. As well as previous scores, the tag notes act as evidence to tell the story of the care since my last assessment. I'm reminded of important events that I identified as important at the time. I can also review how the person themselves feels progress is being made. But more than that, as I make my value judgment, I can also review the timeline of the support given. This includes the notes, assessments, the changes of service, the incidents and accidents that have happened during the period. And now, reviewing them in this context, I can identify the events that I consider to be important to the progress of the outcome. At which point I can choose to link a particular timeline event to the outcome measure. I can also open up the detail of the event to remind myself of any further information that may be relevant. This further information may mean that I now decide that something I thought was important at the time now does not seem quite so vital and can be removed from this particular evidence picture. Everything remains in the Carista record of support provided, it's just that some things tend to be more relevant to a particular outcome than others. With the relevant information gathered, I can now make my evaluation of the outcome measure, and if I wish, add my own notes. This process can be repeated for all of the outcome measures. Once these have all been repeated, a snapshot can be taken as a new assessment. This snapshot can now be printed as an outcomes report. At this point, we can take decisions on the degree of detail that we would like in the given report and the date ranges. This may be dependent upon the type of support given, the purpose or the audience of the report. When we get the report, we can see the headline information and we can see the framework assessment information. In this case, both from the initial baseline assessment till now and also from the last assessment till now. We also have the headlines regarding the personal outcomes and their progress. And then we see a summary of the events that have been identified as important and also during the same time period what individual outcome scores were. And then we go into the detail of each outcome measured, what the score assessment was, and also what was the evidence from the care record that we feel was supportive of that measure, and even the personal outcome that was linked to it. The comprehensive report then provides the opportunity to view things from the other angle, with the personal outcomes as the focus, their progress, and correspondingly which framework outcomes are linked. And finally, the report has the option to print out the timeline elements that tell the story of care. It is worth remembering that we can decide which elements to include in the report, depending upon the way we operate the service, the nature of the outcomes measured, and also who the report is for. One of the key drivers as we made the outcomes module was flexibility. We wanted to ensure that our customers had the ability to make the changes that they wanted to make. And so we've given them the ability to configure the outcomes frameworks. To adjust them if they need to. And also to add completely new ones if they wish. So all in all, we tried our very best to listen to our customers, and the result was the Carista Outcomes module. So for the commissioner and manager needing to look across a cohort of people, we provide the ability to score on framework outcomes. For the providers that have multiple services and need to report to several funders or across several frameworks, we provide the ability for them to configure and add new ones themselves. For the translation between framework outcomes and personal outcomes, we provide the ability to record both and create links between them. For having the discussion about the progress of personal outcomes, we provide 3 measures: progress toward the output, how does it feel as an outcome, and the opportunity simply to record the narrative. To maintain the link between the planned outcomes and the day-to-day support, we provide the ability and reminder to link notes to outcomes. To help to ensure that outcomes assessments are evidence-based, we provide the information gathered from the provision of care and make it available at the point of assessment. And as for the concerns about how much is recorded by frontline staff and the relevance of it, we provide a format to record the key information that was recorded anyway. It's just that now we present that information back to you in a way that lets you take the decisions you can on what is relevant. And it was quite an exercise pulling all this together. But now that we have done it, it's very rewarding. What we've got is we've got customers say that they've now got staff telling them that they properly understand what outcomes actually are. We've had customers telling us that local authorities, other commissioners have come and visited because they've been able to say, show us how you're doing your outcomes, show us how you're achieving that. And we've heard that as a result of this, even some better outcomes have been achieved for the people themselves. That's not bad, is it?